couple quick slides. I'm going to leave the lights up a little bit. This is pretty straightforward stuff. This is from Mike Main's lab in Kansas City, St. Luke's. I think he does a great job. He was really at the forefront of the safety issues. Let's just run through a little bit in your lab. I'm sure most of us know this stuff. These are the sort of the 5 things that he guides us by. Let's look at safety. This is when we began the issue with the warning severe reactions by the FDA. Now, this slide I really like. I think you all can see that. Yeah, it's a little suggestible. Now these are the reported cases by year to the FDA, and it doesn't matter who reports these. Anybody can. So I don't know what to make of this. Were there bad batches in those years and it went away, or were people suggestible? I don't know. The point is, we are all aware there can be some side effects. Now, I pointed out the safety on this slide. Now, let me just look at this is your real incidence of side effects. They're not zero. So allergic anaphylactic reactions, very rare, but always be aware. And that's the real numbers. Now, before there was all this hand waving, we didn't really know what the numbers are. We do now. We spent years studying this. Now, this was a very interesting study mandated by the FDA on 2 of the bubble manufacturers. At that point, Bracco's agent had not been approved. So what did they want? They wanted to take people who had high pulmonary artery blood pressures and inject doses and monitor them very closely to make sure the PA pressures didn't change, because some of the fears were, oh my goodness, you get a pulmonary hypertension patient and they could get critically ill. Why? The microspheres are half the size of a red cell. They don't get stuck. I would be much more worried when you do a pulmonary lung scan that you're blocking arterial vessels in the artery. Anyway, we did the studies, everyone's happy, and you can see what happened. Nothing, okay? And there's a large registry too on the right side, thousands of patients, not a problem. Critically ill patients, not a problem. And specifically in those people who had pulmonary hypertension, who were studied intensively, not a problem. So again, these kinds of things need to be put to bed. These were all published papers. So let's move on to expect the unexpected. And I like that. Typically, you'll see 2 types of reactions with the bubbles. The protein shell or the phospholipid shells. They may have different reactions. One is typically called IgE, and one is a Carpel, a complement activated reaction pseudo-allergy. Comes from that. And the reference is from 2005. It's really small print, but all these slides will be available on the website to you. Be aware, these reactions are different. Now, let's take a look. So this is Carpel. What are you going to see? A number of drugs like this can cause that. Any small lipid particles, liposomes cause it, solvents, contrast agents, all right. And what do you look for? And I think we all know this. These are the common things that we see. And Mike has an allergy kit, which we're not permitted to have by JACO. I don't know if any of you are either, because we have crash carts, but we can't have an additional allergy kit on top of that. Does anyone, we all are JACO compliant, right? Okay. Yeah, so at this point, Mike wasn't, I don't know if he is yet. And then these are the meds in the crash cart. And I will point out, he does have an EpiPen, and I'll put, there it is. And we don't. We don't have it available to us. It has to be in the cart. And I think that's pretty standard. The other thing I would mention is we are now restricted. All of our contrast agents are in Pyxis units throughout the hospital. None of us put it in the pocket from the acro lab and go up to the ICU and have a syringe filled with a contrast agent, which I agree we feel is okay, but it's probably not, because who put that in? When did they put it in? How long is it? So every station now has a Pyxis, and you have to have a request, you have to go there and pull it out. So it does make it a little more cumbersome, but for standards in the hospital, I think it's okay. So we fought through the Pyxis, and we now have our agents loaded throughout the hospital daily by the pharmacy. But as far as the EpiPens, no, we don't. Does anyone have an EpiPen loose? No. You do. Jaco? Not an issue?
We're seeing more and more labs do that, just have an allergy kit.
Really?
Rather than going into a crash cart, so they don't have to go into the crash cart. They'll just put together an allergy kit. And I think there's a webinar online, I think Kevin Way's lab does that. They have allergy kits. So we're seeing that a little bit more just to have them.
That would be something, along with the strain, we should put that as an ICUS thing to investigate. Can you have allergy kits outside of the crash cart? There's no answer. Another third thing, of course, is who starts the IVs, but let's just deal with safety. Thank you. So it looks like nobody here has EpiPens except Tom. Anywhere in Chicago? No. Yeah, we're so afraid of JACO. Our hospital actually had a CMS visit too. That's not JACO, that's CMS. It's several steps above. It was pretty tough. All right, encouraging contrast use. What are the obstacles? And Val hit it. How do you talk to the administration? Well, you got to have somebody who's committed. And if you don't have a medical director, technical director committed, I think our position over the years has been don't bother. You can't, make somebody do something they don't want. You can present the data, you can say, I'll take charge, but generally if you don't have somebody shepherding you, good luck. What Mike has and every lab has, what is your protocol for using contrast agents in a patient? It goes in your policies and procedures. What is your policy for doing this? And you could ask, do we do a consent? No, we don't do a consent. And we can discuss this, and this is always a topic of some excitement here. When you use an agent of any kind that's FDA approved, do you discuss with the patient in detail? Let's start with radioactive agents. How about the spec agents? Do you discuss in detail with your patients what the effects are? Do you? Do we discuss the radiation effects? Does anyone? No. Okay. When you're using a half a dose of a drug because the patient can't tolerate higher dose, do you discuss why? No. When you add a beta blocker to somebody's regimen, do you say, here's the side effects? No. Okay, so I would say the bubbles we use are drugs. They're not devices, they're drugs, like any other drug. And do you go through the whole list? Now, I will tell you, a colleague of mine out in San Diego said, Steve, we're getting so many adverse reactions, itching or scratching, or there's some odd, like my hair itches, a lot of issues. And I said, well, how are you addressing this with your patients? Oh, he said, we go through the entire adverse event list each time we use it. I said, now, do you do that with everything else? Do you do that with dobutamine, which, by the way, is not FDA approved for your use? Do you do that? No. Well, why don't you standardize your lab's approach then to every test? Like, what is the side effect of a TE? Should you go through everything, one in 10,000 die? So I think what you need is standard procedures, and if you don't, then you set yourself up for some real issues. So does anyone here use a consent for ultrasound contrast to have a patient sign before they get the study? Anybody? Does everyone orally talk to the patient, say, we're using a echo enhancement agent, which is the preferred term in echo? We talk to them. Do we go into great detail? Do we say, no? I know. Just compare and contrast. You go over the Nukes lab. Let's talk about gadolinium for just a second. Does anyone say there's some issues with gadolinium retaining in your brain? What are some other obstacles? This we can go through. For 20 years, we faced this issue. There's no one to start an IV. Can sonographers start IVs? The answer is real simple on that one. Yes. Yes. Mulholland knows that. We've done that for years. Here's the problem. There is no state, local, or national rule. Nothing. Nothing exists. It's an ICUS issue we've been looking at, and Bev Gorman's one of the ICUS board members. She runs IACL or ICAL. She runs that, and she is a sonographer, and she's putting out webinars on sonographer use of IV starting for contrast. So if you go, again, I think to our website, we will have those posted, but if you go to IAC, Bev Gorman will be there. So send us an email, let us know your questions, but there is no standard anywhere in the country. We don't get paid, wrong. There's your forms, we do. Okay. We talked about this, we won't go through this much more. Yeah, good quality labs standardize their testing. This is probably the best example if you need to show this to anyone. This just came out by American Society of Echo. I think Tom was the lead author. And this is what you do. You can measure with or without contrast, but do it well. All right. Therapy matters. Yeah, let's move this. Now, enhancing outcomes. We've really talked about this. When you're pushed, say, why are you using contrast? We've already gone through the data in 2009. It improves patient quality images, reduces ability to make mistakes by missing thrombi. It saves lives. We went through these slides. It saves money, thrombus, and this was the big one again, the death. So, is contrast safe? It is safe. Are there chances you can get a bad reaction? Yes, there are. And be aware of them and be prepared in your lab. And sometimes, every 6 months or so, go through an exercise in the lab. What if we get this? What are we going to do? So be aware of that. And then, as we say, if you can find a champion in the lab, somebody who will take this on, that's really nice. Let me pause there, I think. We'll take another little break. Coffee, I think I have one more following this. Any questions on safety in the...
Sulfur hexafluoride, sulfur allergy.
You fire away. And Tom, while you address that, would you mind addressing eggs? Albumin in eggs?
Well, I think one of the things that we get asked some of the voters is starting to find out that the sulfur hexafluoride is in.
Well, Tom, can you turn that on? Your mic on?
As we see the sulfur hexafluoride in patients will wonder, what about sulfur allergy? Okay, but it's totally different. There's no correlation or reason to believe that if you have a sulfur allergy that you have any adverse reactions to sulfur hexafluoride. Totally different compound. I won't go into the chemical details behind that, but you may get asked that question too by patients if they know a little bit more, because we know that Dr. Google rules, and so if so they will look up everything you're giving them and see what's in it, and then ask questions about it. So beware of those kind of questions too. But it's not using the Lumason agent is not if you have a sulfur allergy, it's not a contraindication. Is the bottom line. Totally different chemical structure.
What about egg albumin?
Yes, and albumin. Well, as you know, the blood I guess the issue there is if you're Jehovah Witness.
Yeah,
and so
some Jehovah Witnesses.
Right. And so that I think it's
what
important
if
that
I'm
this
allergic
discuss
to
that.
eggs or shrimp?
Right. And so none of those are important in that particular case for use of an albumin-based product. But you do have to respond to the issue that if it's a blood product, so I don't know if they're using synthetic albumin now for ultrasound or not.
No.
I know there was some issue with that a few years ago. There's someone from GE here.
Yeah.
GE, okay.
No, not synthetic, and it's the FDA has classified as not blood product.
So not okay. So there's an important. That's a good thing because it still shows up on a lot of the contraindications list, and I think that you might want to update one of your slides, Steve. It still said right to shunting.
It's not contraindication because it has been tested in patients that have an allergy to blood, but the FDA has classified albumin as not a blood product.
Okay, so we still have to be listing it then if you have an allergy to blood products, then.
Gotcha.
Even though it's not a blood product. Okay.
Well, remember too,
there's confusing things out there, right?
the interesting thing, just as a side note, okay, the very first ultrasound contrast agents were classified as devices, not drugs. And the FDA still classifies the active component of the microbubble as the gas. And yet the gas is classified as a device for actually treating patients with retinal detaches the detachments, you can inject it. So the gas itself, on one hand, is a device and it can be used, but as far as the bubbles go, no, that's the active component in the bubbles. And the shells are not the active component in contrast. So it's a little bit inconsistent. One is a drug, yes, one is a device, but the gas is the problem here. You know, yeah. All right, so I think we just go on.
Just to make that, that's come full circle now, so talk about this afternoon in the whole area of sonal thrombolysis. They now want us to reclassify the ultrasound as and microbubbles as a device again, so.
Really?
Yes,
FDA?
yes.
Oh. Well, folks, look at the reason, and Tom's on the board of ICUS. Everyone likes bubbles and ultrasound, but everyone's busy. And if you go to, let's say, the American Society of Echo, the American Heart Association, the American College of Cardiology, and you say, hey, can we put bubbles on a priority? Yeah, there's about 10 things before you, and I understand that. So ICUS was created just for us. We wanted the bubbles to be heard, and I'll have to tell you, the data we present shows why. So we are standing very firmly on good ground, and Tom's issues with sonal thrombolysis and the device, fine, those can be revisited, but we now have thousands of people, ICUS members, and we send you a note or sign a petition, we have thousands respond. So we are now a political force in the world to defend contrast. Okay, good, enough case for ICUS? Yes, thank you. Did everyone sign up yet? Megan, have you signed up? Okay. I don't think she did.